Good day everybody, I am Hani Asmin Hafiz from University of Plymouth and I'm going to present a study on design intervention in assisting lower back pain in elderly patients. So I'm going to start off with the definition of the elderly. Who is the elderly? It's a group of people who age 60 and above, which is defined by World Health Organization, and it is predicted to be increased by year 2020 to 3.2 million in my own country, Malaysia. And as the years grow, the elderly population also increase, and it is forecasted that the demand for assisted living products and services will increase as well. So what are the common issues among the elderly? As from the pictures here, they are all suffering from lower back pain. So it's quoted by Dr. Omaisa. He said that lower back pain is common among Malaysians and bad sitting posture could lead to this. And from Dr. Sabaro, he said that at least once in a lifetime a person will experience back pain, and for the elderly, LBP is common. So what is lower back pain? So this is a diagram of our back spine, and as you can see here, in lumbar vertebrae L1 to L5, that is the place that lower back pain takes place. L4 and L5 are the common vertebrae that related to LBP, and prolonged sitting causes all pressure directs to L4 and L5. Well, lower back pain can be caused by pathological factors, which is from the disease or osteoporosis, arthritis, etc. And another factor is stress factors, which is caused by muscle strain, stress, and fatigue. And this is verified by Dr. Faza Hanapia, a rehab medicine specialist. As a designer myself, I'm not going to focus on the medical perspective, as I'm going to stress on the stress factors, which is the muscle strain, stress, and fatigue, which is not related to disease at all. So what is the problem statement? Well, the chair as health hazard, which is quoted by Dr. Colin Krantz. In her book, The Chair, Rethinking Culture, Body and Design. And how lower back pain relates to sitting. And from the picture here, we sit during our childhood time, and at school, in the university, and our workplace, and when we get older, we have spent most of our waking life sitting, and it is nature for us to sit and hard to change that. And we're going to spend most of our waking life by sitting. So what are the research questions that related to the study? They are how sitting can contribute in minimizing the pain, what type of sitting that fits best for lower back pain in elderly user, what are the challenges faced by elderly when sitting. And this is the research direction for the study, which is focused on immediate problem solving, which is content-present problem. It is not focusing on preventing or long-term problem solution. And the aims of study is to minimize the lower back pain in elderly by producing a suitable chair for them. The objectives of the study is actually to design appropriate chair for the elderly and to counter problems faced by elderly when sitting by producing the best sitting solution. So from the study, I'm going to discover a problem faced by the elderly when sitting, and the research methodology that I'm using is divided into 4 sections, which are finding and discovery, which is search the research interest and the gap, like by doing issue analysis, questions and answer, and by using the empathy design approach. And then going to the stage 2, which is the analysis to make everybody understand, which is I'm going to use tool as data structuring, design direction, and design finalization. And then I'm going to the stage 3, which is evaluative stage, which is experiential and improvement. And then to the final stage, which is the generative, the most important part, which is idea generation, and it's going to come out with a final product. Qualitative data approach is selected for my study as it is more comprehensive and is more appropriate for design perspective. And I did observation and few interviews with expertise and target group, and observation is done, and I managed to collect few case studies from different nursing homes and private homes. So observation is done at social welfare home, which is Rumah Karis, and also private nursing home, which is PJ nursing homes, and a community house, which is a private home owned by Puan Hapsa Ismail. And these are the photos that have been captured at the social welfare home, and these are type of chairs that they've been using. And these photos is from nursing home, which is currently they only use wheelchair as the main chair. So I did few interviews with the ergonomists, caretakers, designers by email, medical experts, and medical expert is needed to verify all the data finding, and the ergonomists as well, and the caretakers to really get the empathic approach, which is I can get the first-hand experience from the caretakers. What are the challenges? What are the complaints? And the elderly themselves will really talk to me and complain about the lower back pain that they have been suffering. The next stage, which is the design process, it is common to define and collect, brainstorm, develop feedback, and improve the design. And I've managed to get few guidelines from the rehab medicine specialist, which is for older people it can become increasingly difficult to use standard sitting. An elderly who has lower back pain has shorter torso, thin buttock tissue, and curvier lumbar, and also the elderly preference which is bulky and sturdy to make sure that it looks safe, and appropriate height for the armrest. Sitting with reclining ability sits best for the elderly to get in the chair and out of the chair, which is directed me to a solution, which is a pneumatic chair. I need to do analysis of project-related factors that might influence my products, which is the usability, technical, or aesthetic. This table helps to direct the design, whether you want to go to the functionality or technicality or the aesthetic part. So, and all the criteria is verified by few experts, obviously. And from the usability part, the upholstery must be thick padding, the armrest rests at appropriate height and has lumbar support, headrest, recline, or pneumatic chair. So the technicality part is pneumatic, is piston gas mechanism, so it's able to recline. And the upholstery is airy material or fabric and foamy, and the ergonomic part is lumbar support and headrest. And from the aesthetic part, the emotion for invoking sense of belonging and love in order for the chair, bulky. It has to be bulky to create sense of security, sturdy, able to hold any weight, maximum 120 kg. So the design criteria will be developed into this kind of pie chart, which is the design directs to more towards functional, comfort, assistive, cost-effective, pneumatic, and pain relief. For the technical part, the material should be vinyl, PU banded metal tubular for the structure, and rubbery finish for the armrest recline, which is the piston gas. And the aesthetic part, it must be a silhouette of backbone or silhouette of anything that relate to promote healthy structure. Color must be back pain color healing therapy, which is yellowish, evoke love and emotion. So this is the early concept ideations, which is derived from the lotus plants. And after selecting 3 final design, the designers has selected the third one, and by 81.1%, which I distribute this table to all designers friends, and they have selected the third one. So I'm going to develop more on the third concept. And next is idea exploration. The images showing the concept or armrest structure, or maybe the texture that is related to the findings, and the form, which should be more bulkier. Therefore, come out with the final design, which is that one, and managed to develop few mock-ups so that to convince myself to look at 360 degrees. And this is the piston gas mock-up. like before entering the full scale mock-up phase, you need to do the mini mock-ups, and this is the final scale mock-ups. It's actually to get the right size for the elderly, and therefore there's the measurements for the final chair. And I did a mock-up testing, which is consideration that I've bear in mind the armrest, the neck rest, the lumbar support, and the piston gas. There's a lot of sponge to help me understand the possibility of the elderly feel discomfort at any points. And here's the gas lift mechanism mock-up. Well, I built up my own pneumatic gas piston, and it failed to lift by itself, which means the mock-up cannot lift the elderly occupant soon. So I've decided to just use Duramat lift set, which is it can be ordered out from the eBay, and it's already a success product, and so it will definitely work. So when I managed to understand the right measurement for the chair, the structure, material, upholstery, and all considerations, so need to finalize the form and prototype, and then do testing. So this is the design finalization through 3D visualizations, which is relief, it's called relief, and its color is quite yellowish. And look at how it lifts the occupants to get out from the chair. Well, the challenges that being faced by the elderly is actually to getting out and getting in from the chair. So by making relief, it is predicted to be able to assist the elderly to get in and out from the chair. So there are the color options, which is navy blue or the dark brown, and this is the finished semi-prototype. It's not successfully working as the Duramat seat need to be ordered out, and it's kind of time constraint. So there's a beautiful lumbar support that will lock and grip you when you sit on it, and the right appropriate armrest for elderly to rest the arms, and also extra pillow for extra comfort for the lumbar rest. And the process of the prototype making. And my recommendation is study the prevention of lower back pain in elderly and controlling the prevalence of lower back pain since young. Or if we can't reverse time, we need to design a right chair for the youngsters or for the kids to be able to sit at the right posture. And I'm going to recommend people or next researchers to study on sitting design, which can help to relieve lower back pain in elderly. So my conclusion will be design solution that incorporates lifting mechanism can be defined as assistive, as it promotes elderly to be able to get in and out of the chair independently and elevates the standard of living of elderly. The chair should be a benchmark for designers that wish to embark in designing for the elderly. Thank you so much, and for any inquiries, please email me at happies@plymouth.ac.uk or hannah@umk.edu.my. Thank you so much for your time.